Okay, everyone, excuse me. Welcome to the Breaking Down Coding Cases for BC 2030, Week 3. So what I've here is a few of the questions that you're going to be going over in your Week 3 coding assessment. But what I wanted to do first is just to make sure that you all know how to make sure I have the right window open. Okay, I wanted to make sure that you all know how to print your assessments. So when you go into the classroom, what you always do is go to reading materials in order to get a copy of the coding application. So what you do is, as I'm going through the cases, you would download this particular application or click here to save it or print it out, and or copy and paste everything on here, and then that before you try to take the test. Okay, so I am going to get started. If you cannot see my screen, I tried to make it a little bigger. If you can't see my screen, then the best thing you should do is make sure that you download a copy of the actual assessment so that you can understand everything that I'm saying. What I did here is I highlighted the key points that you need to make sure that you review, and these are the items that you look for when you're coding. So for number one, the full question, it's a very short answer question, but there are a few things that will make it complicated. The question is, what is the add-on code for the coronary artery transcatheter placement during coronary intravascular therapy for delivery of the radiation service device? Okay, so this particular question has a few key pointers, and it is I solved them, but I did not put your answers in because that would be cheating. I want you to make sure that you go under and always start in your index of the CPT manual. There's diagnosis coding. You would look for your main term that I have highlighted here, which is coronary artery. And then the next main term or subterm underneath that would be placement. So what you're going to be doing is looking for something related to delivery of radiation device, and then, of course, you're going to have some subcategories that refer you to radiation delivery device. And you will find your add-on code there. And you know your add-on code has a plus symbol in front of it. So you know that you've picked a correct code when you get there, and there is a plus symbol in front of that actual code. Okay, I'm going to move on to the next one. And I've highlighted some important things here as well. We have the radiological examination of the eye for foreign body. A radiological examination is the same as saying X-ray, X-R-A-Y. You can either go to the index and look under radiological examination. You can also look under X-ray. Now, the key word is eye because that's where, and the type would be for foreign body. If it matters, in particular description of the code, you may run into the word foreign body not, depending upon whether you're coding from a 2011 or a 2012, if it makes a difference. But these are your main terms that you're going to start in the index to look for. Radiologic examination or X-ray, and then refer to the subterm I, which is where it is. And then, of course, there is a code, or should be a code, depending upon, we're starting for detection of foreign body. And you know that foreign body is anything that does not belong in the eye. So if a person has debris or glass or something like that, then that is what a foreign body is. Okay, on to number 3. Number 3 begins just like number 2. Radiologic examination, where? So you would start in the index for the word X-ray if you can't find it under radiological examination. the term underneath or indented underneath there would be ribs. The tip would be unilateral because, as you know, your chest has two sides, a left and a right. So since they're only taking a unilateral view, then that is an important word. You have to make sure that the code you pick has unilateral in the description. There are two views. Even though it's one side, there are still a possibility of getting two shots, which is front to back, which is anterior, posterior, and lateral. So you may see PA and lateral, or you may just see two views, because that's basically what it means when you're doing an X-ray of the chest. You have the options of doing it PA or AP and lateral. Do left and right, or you can just do the right side or the left side. Okay, that one is covered. Number 4 is the computed tomography of the thoracic spine, and the way that they did it is without contrast. Now, to the index of the CPT manual, you're going to look for CT scan. Even though you may go under computed tomography, it's going to refer you to CT scan. And once you get used to coding, you're going to know that you start there and just skip over computed tomography. Now, the way that you code these is exactly how we coded the X-rays. You would go under thoracic, you would go under without contrast, because you have the with contrast, you have with and without, which are subterms underneath, and then you end up under without contrast. If you keep looking further down in your index, you're going to see the part of spine. You're going to see the word spine, and of course there's 3 segments, and you're going to get to the word thoracic. It's going to be your code just by that. Now remember, you should never code from the index. You always need to cross-reference your code to the section of the CPT manual that you find it in, simply because there may be some additional instructions, and you don't want to overlook those. 5. Number is a little longer, but it's very easy, and I think I've only did 7 of these. Let me see. Yeah, 7. So we have, if I can find my little, okay. So it says, number 5 says, and here are our keywords highlighted. Established patient is seen in a clinic office. So we already know what type of visit this is. This is an outpatient visit, and it is an established patient. Now, I've already spoken to you guys about E&M coding last week. The thing that you would do for E&M coding to make it easier is to just begin in the E&M section in front of the CPT manual and start with your sections, your locations. Your location is outpatient clinic, and the type is established patient. Once you start there, the next thing you need to do is match up your key components. So it tells us that the provider performs expanded problem-focused history and expanded problem-focused examination. So we already know that the going to be based off of established, outpatient, expanded problem focus. His medical decision making doesn't matter because you only need 2 of the 3 components, and that's what this particular scenario is giving you. Now it says that he's ordered a CT scan of the head. So what they did is they did it in the office. So we're going to have a code for the physician, which is your office visit code. Then you're going to code for the radiologist. You're going to code the CT scan just like you did number 4, but the place will be the head, or the body part will be head. And then, of course, we see that there was contrast material used. So since we do have contrast material, we have to go in that particular section or subsection in the index that says contrast material or with contrast. Okay? Moving to number 6. Number 6 seems a little complicated because you're dealing with pathology. Number 6 just has that it's a specimen received, so we're coding for the pathologist. We have 2, A and B. A is endocervical curetings, and is endometrial biopsy. I did the type of pathology that was performed, which is gross examination and a microscopic examination of both of the specimens. So the way to find this particular code is begin in the index of the CP under the word pathology. That will be your main term. Now, go to pathology, you're going to see indented underneath the surgical pathology. And underneath there, you're going to see gross and microscopic. And then, of course, if you've listened to the regular weekly live chat lecture, you should look that there are different levels. So the code, and the code depends upon the specimen that was that the provider had to do the examination on. So once you see the different levels, it's going to begin you with level 1 and level 2, and it's going to give you some code ranges, and you can start with your code range there. If you have a 2012 CPT, it's going to refer you back to page 310 and 311. You're going to have the heading, which is your guidelines and your notes, surgical pathology, that explains to you how you would code for surgical pathology. And when you look at the different levels, you just look down inside of like the level 1 through 4 and see if you can find the body part. You're going to be looking for endometrial curettage in biopsy and or endocervical curettage in biopsy. So you have just one code for this particular procedure, and the reason is that one of the specimens did not have enough sample left over. So you're just going to give one code for one specimen. Okay? And that's it. That's as simple as pie. You should find your code very easily following those instructions. Last but not least, number 7. As a 20-year-old male in full labs due to chronic asthma. Now, our key word in this particular sentence is chronic, and that's because it's explaining to us that the patient has had a long-term problem or diagnosis with asthma. The doctor gave him a theophylline test, and the theophylline test is basically just checking the levels of theophylline in his body system. So from there, this particular type of test is known as an assay, or an immunoassay, or a lab assay exam. And what you would do is just go into your CPT X and look up the word theophylline, and it's going to give you just the word assay right there, and it's going to refer you to a code. So when you get to that section of labology, in the lab section of the CPT, all of your instructions related to laboratory testing for drug assays, there's some guidelines that you would read to explain to you how and when and why to code, certain things. But it's easy to find this code right here. So this is where I left off. You have 3 more left, and most of them, the ones that are left, are similar to the ones that we just covered. So if you remember what you've done and follow follow back through my instructions and follow back through the chapters, you guys should get 100% on this particular week 3 assessment. Thank you for watching. Have a great week.